so understanding.
Number one is a focused effort around teenagers with HS.
I am a member of
the HS Supporters.
Here it is. It's not a sad thing for me, guys. It's therapy to talk about it. It's therapy to talk about it. People are just looking my life. He just I never shut up. All right, Miss Kelli Brown. Miss Kelli Brown. All right, we're officially recording. Let's give it a couple seconds.
Okay.
We're here today with Miss Kelli Brown, myself, Ron Bercume. The most important reason to talk about HS awareness and our personal experiences, but the meat and potatoes which make up those stories, each of our personal stories. And I didn't know this until we talked earlier, Kelli, but even at 18 years old, you're rather a veteran yourself within the HS conversation. Now knowing how long you've lived with the disease. So I'm pleased and I'm blessed to be here with you to learn more about your story and more importantly to share it with other people who have dealt with the same struggles that we go through. Are you still there? Did you break out? Did you break out on me? Okay.
What did you say?
Is it breaking up?
Yeah, it was, but I think it was because my Wi-Fi was messing up. But I changed it,
Okay.
so it should.
Well, let's just keep rolling. No worries. So if you want to go ahead, I didn't give you a big introduction there. I'm kind of sick. I'm not myself right now, so bear with me. Be patient. But we're here to talk about you anyway. So if you want to go ahead and introduce yourself a little bit, a couple high items that I'll just mention that we went over on a preparatory phone call a couple hours ago. That you're 18 years old. You work, you live, you're in school out of Mississippi, if I'm correct.
Yeah.
We didn't want to go into too much of your story because we were going to record this to share with other people, but you told me that you onset with HS at 10 years old, and to use your words during puberty.
Yes.
And I say that because statistically and scientifically it's relevant. And then you were diagnosed 2 years ago, or 2 years thereafter, at 12 years old, which would be 6 years ago now that you're 18, right? So I say that you're a vet because you kind of are. There's been some major advances, at least in the realm of what advances have been made with HS or acne and bursa in the last couple of years have been the most important. As we all know, we go through these big stretches in history with HS treatment and research where not much happens, and we're blessed in our generation. You're a different generation than I, but these latest generations are blessed with actually seeing some real movement. And I'm hopeful and I'm optimistic about the future and what we're going to see just in the next couple of years. So until then, we have a lot of awareness to tackle, don't we? And I think that's why you and I came together. You have some amazing energy. I always talk about HS heroes, and I've been following you now for a couple of weeks after you reached out to me on YouTube to say, hey, let's make some videos and save some lives, right? A little bit of that background. So that's how that started. So without further ado, Miss Kelli Brown, HS patient extraordinaire, awareness junkie, and activist. Right? I think I'm not quite sure, honey, if you're sharing your video. It seems to be a static frame. You can share it however you wish. I definitely hear you. Just to let you know.
Okay. You can't see my video, is that what you're saying?
No, I see your face. It's frozen. If you want to leave it like that, that's perfectly fine. I can record your audio. It might run better like that. As a matter of fact, I'll leave that up to you.
My video's fine. I don't care.
Okay, go right ahead.
Well, I'm Kelli Brown. I have stage 3 HS. In my stage 3. Well, stage 3 and stage 2 because I'm on Remicade, which is bringing me down to stage 2. My chest just started with a hole in the middle of my chest. I didn't know what it was, and I wasn't gonna tell my mom what it was because I was scared. Because I didn't know. We went to the doctors. It was nothing but antibiotics, and more antibiotics. And the time when the doctor finally sent me to a surgeon, all I could see was a little dot. But when I came out of surgery, I was cut under both breasts. Just left wide open like that. And that was when we first learned about HS. So I didn't know that I wasn't gonna heal. That I was actually gonna get worse. And I think by age of 12, that was when all my HS really, really started. It was just on my chest. I didn't have it anywhere else. And that summer, it came under my arms. It was the worst. I couldn't lift my arms past my shoulder. My arms couldn't go up at all. Through all that, I was still in school, still trying to, smile and make life better, even though I knew all the pain I was going through.
Okay, Kelli, can I kind of slow us down here a little bit too? And I know listening to more of your story that than what you went over to me with me in brief earlier. Some of these major milestones against your age. You're 18. I believe you said you onset at 10 years old. That's an 8-year kind of HS career. I think that's substantial, something to speak of. And you've been through some stuff. Bless you for that. So just to rewind just a second here. Can we go back to, when you were 10 and just briefly, what was that milestone? What was that event that maybe your mother and yourself came together on? I know I said I know you told me you were already in surgery and such. So could you kind of go into a little bit more detail around that? What that was like in the beginning?
It was, no, my mom didn't know. I didn't know. We were just basically waiting to see if it got worse. Mm-hmm. Because, the doctor was saying it was nothing. So we didn't think it was anything either. So it was just a waiting game.
Did they have any ideas, any guesses? Like, do they have a name for anything, or was it?
The doctor told. Oh, I'm sorry.
No, go right ahead.
The doctor, because we did look up something and we saw hidradenitis, but when we told the doctor, he said, "No, I've had a patient like that. His clothes stuck to him. She doesn't have hidradenitis. His was worse." Yeah. And that's the only thing we heard. It was him comparing me to another kid.
And this was when you were 10 years old?
Yeah.
Okay. And it took you 2 years after that until you were officially diagnosed, right? And I believe that's where you were explaining that surgical event? Do I have that?
Yeah.
Right? Okay. Can you go back into detail a little bit about that for me?
I was going in just to get the middle of my chest, just to get the little. It was little. I was going in just to get it took off. And my mom said when the doctor came out, he had a doomed look on his face and told her that I have HS, hidradenitis. I was cut from the top of my chest under both breasts, which I was only 12 years old, right. And I was still trying to be in school, so it was hard.
Yeah, I'm sorry.
It's okay.
Yeah, we all, not myself, obviously, but we have a lot of compassion. I think I can speak for you too, for what some people go through. Yeah. Okay, so and so what happened after that? That's the beginning. That's kind of when this whole world opened up for yourself and your family, your mother, I believe, right?
Yeah.
Yeah.
It was, the doctor sent me home with no wound care, 10 pain medicines, and still to this day, my chest is not healed up from that surgery years ago. Oh, no. So then that was just, I guess, us learning about HS and learning how it's not going to heal.
Yeah.
And yeah. So, it kind of hit me. At 12, I'm supposed to be worried about, am I going to make school teams or all that stuff. But hospital was what I was worried about.
Yeah, you were kind of, there's a lot of different ways you could look at it, but you were definitely thrust right into adulthood, right?
Yeah. I had to learn quick.
Well, one of the benefits, if we're trying to stay hopeful here, that is one of the benefits of being a chronic disease or chronic illness patient that I like to say sometimes, being that, unfortunately, you're forced into seeing the end of your life, right?
Yeah.
There's some insight in there. I think there's something beautiful in life around that. So kudos to you. Yeah. So that was still what, 6 years ago? We're talking, right?
Yeah.
We're talking 6 years ago.
Yeah.
So fill us in on what's happened since then. Has there been any progress? New doctors? Do you still have conversations with those old physicians? If you want to share, what does your medical history look like, being that you've now had to live with this for a very long time?
28 surgeries later. In Mississippi, there's not a lot of there's doctors, but they just want to do surgery and leave. So we ended up having to go to Atlanta, to New Orleans, Alabama, and Jackson for doctors.
Okay. And these are plastic surgeons?
Plastic surgeons, dermatologists.
Okay.
I think every doctor.
Okay.
3 years ago, I had surgery under both of my arms because my arms were so bad.
Okay.
Best decision that I've made because it healed up great.
You hear that a lot, yeah.
Yeah. Well, we were going into the mindset because when it gets down to the groin area, it was getting worse for me. So we thought, well, surgery for my arms worked so good, surgery for my groin will work good.
Mm-hmm.
And I was, before I had the surgery, I was able to work and walk. After the surgery, I couldn't do anything. I was in a wheelchair.
Yeah.
I'm just now finally healing up from it. So
can I ask you a question to interject here for a second? And maybe you might have already answered this. But in between these surgeries, these major surgeries that you had, were you, like your armpits, right? You had surgery that resolved those areas for you. It sounds like there was no reoccurrence. It sounds like. Have you experienced it? It's maybe a stupid question, because a lot of people I know have it everywhere, and if that's the case, I apologize. But did you notice it move? Did you notice maybe your system looking for new areas to create infection where it couldn't kind of reoccur? Does that make sense to you?
I think that it did relocate, but I think it was because I was out pain in my arms that I felt so much pain in other spots.
Okay. So did it occur in new places where it hadn't been ever?
No.
Okay, that's great. Good. That's good. So you may have had more activity or different activity in places it already was, but there wasn't like no new places, I guess. It sounds like.
Yeah.
Okay, cool. That's an important question for me. I usually ask everybody that I can. Because there are cases where people say, like, for example, myself, I've never had it in my armpits. So I question surgery as a treatment option. If I were to have it in other places, is that going to open it up to my armpits, for example, where I've never had any activity? After 20 years, nothing. And from everybody I've ever talked to, I never will. So thank you for that clarity. It's an important question for me. So. But continue. You were telling us about the pathology of your disease and the ridiculous number of surgeries that you've had to suffer through.
Yeah. And then I get, like with everybody with HS, they have a trouble with fighting with doctors. They think, oh, she's 16, we don't want to give her pain medicine because where will she be when she's 40? And that's the case in people who take pain medicine and then it'll be over. But for us with HS, I'm sorry if we're going to be if we're going to be addicted to drugs, but at least we'll be okay. I stopped taking pain medicine because I don't like the feeling of it.
Yeah.
I didn't want to be addicted to it, but while somebody's suffering, Tylenol is not going to work, or ibuprofen it's not going to work.
Yeah, I agree.
And that's what doctors give you. Just take some ibuprofen or Tylenol.
Yeah. I have a similar kind of outlook right now about antibiotics being just recently prescribed. I'm testing them now in quotes. I would say it that way. I'm not taking them because later on in life, I've lived with this disease for 20 years and through one extreme to the next and through one new area to the next and back and forth, and it still reinvents itself all the time, right?
Mm-hmm.
So who knows? I mean, I'm stage 3 parts. I've been worse in other parts when I'm in my early 20s and late teens, and it's always different. But what if someday in 10 years, when certain, as I continue to grow old with all this gray hair, what if I need them? Do I really want to burn them out? I think the same conversation is very similar for pain medication too, because you build up tolerance with pain medication and you build up resistance with antibiotics. So as HS patients living with a chronic disease that we have no control over, we have to think long term like that. Or you should be, in my humble opinion. So again, at your age, kudos to you for being mindful of kind of the big picture, and having some clarity around why you exist the way you do, and more importantly, being aggressive about going out and figuring it out. Why, when nobody else is doing it for us, right?
Yeah. I just have a little story. When
Sure.
I was in the hospital, I was 16, and there was another girl in the hospital. She was 16. She had HS just like me.
Mm-hmm.
She hadn't told her mom anything. She was depressed. We were having the same exact surgeries, which was kind of crazy that 2 HS patients with the same exact surgeries.
Wow.
Except for I was out and I told my mom and I was able to move. She couldn't even get the surgery right off because she wasn't eating, so she wasn't healthy enough to get the surgery. So that's 2 different outlooks. Like I was able to function.
Yeah.
She hadn't even told anybody.
She may have had, just to speculate, she might have had some more things going on around infection, more so than yourself, right? At the time.
Well, I feel like maybe it's because, being young, and that's another reason why I would have a word out, because being young and being in high school and trying to, make sure you don't smell, make sure everything's kept up.
It's horrible, right?
Yeah, it puts a weight on you because you're already trying to live a teenage. You're already trying to, get through being a teenager, get through school.
Yeah, Kelly, let me get us to pivot here, if I can, a little bit too, right to your point. Especially being a teenager and how important that is socially, in social contexts, and within mental health, how damaging it can be, disabling for people too, hiding in stigma and shame and embarrassment, some stuff that we've talked about offline before this call. I think now is a good time to kind of dig right into it, right? I mean, if you want to share what that's been for yourself, by all means, what I'm looking for here, what it was like. Did you hide? Did you not hide? What it was like, yay or nay, right? And that usually comes in the context of me sharing my story, and I'm not going to share it now because there's plenty of video out there with it, but I hid it for 20 years up until recently, right? And, as a teenager, I didn't tell anybody, and it was an STD for me, right?
Yeah.
Which shares similar stigma and mental health issues around, that mind to body, in our case, skin to mind kind of connection, right? There's a lot of science out there around it as well, psychodermatology specifically, but lots of good stuff. So, what are your thoughts on that, on being embarrassed and having shame? And we talked about how I feel, and I think everybody should, because it's the truth, is that these are just all ideas and they're not real and they're fake, right? Because the truth is, we're sick because of Mother Nature. It's not something we did. It's not our fault. Therefore, how could we have anything to be ashamed about? Why would we need to hide anything? It honestly pisses me off, as people know, right? And I do have compassion, absolutely, for compassion, for patients who aren't ready to share, aren't ready to be open and public about it, right? God knows I waited 20 years. I didn't know what it was. As soon as I found out what it was, I haven't shut up about it, right? I think if I would have found out earlier on, I would have probably been loud about it as well. As a teenager, maybe not. I think I would have probably still have hidden it, which I did, as something else. So that's that's not my whole story, but that's the high level kind of, my opinion and via my own experience, that it's disabling and it's horrible, especially for a child and a teenager. Forgive me. I almost have a 15-year-old. She was a child, right? And it would kill me. It would kill me. I'm in this because of them, and it would kill me if she had to hide it. Not on my watch, right? She can hide it however she needs to, but I hid it and I didn't get treatment, and I suffer for it worse so today than I probably should, because of that.
Yeah.
So.
Me with the embarrassment thing, it was embarrassing because what am I going to tell people? Because, kids are cruel. As soon as you tell them something's on my skin, it's a STD or she's contagious. So it was me either telling them, I even had to lie because when I wasn't in school, they'd be like, what's wrong? And I'd make up some other kind of medical thing because I didn't want people to know. Because like I said, if you go searching online, it's gonna be stuff out of the world, and kids will run with that. So I was embarrassed in high school, well, in middle school, because high school I wasn't really in school because my hidradenitis had got so bad that there was no way I could function, and people would know something was wrong.
Yeah.
And I recently just came out about my HS because I thought, like I told you, HS is just my normal. I don't have any other normal but HS. It's my life.
That's right.
So that's how I started to realize that, I can't do anything about it.
Yeah. Well, I mean, what I had this legacy conversation, and I've touched upon it with you around morbidity, right? And I talk about it all the time. It's centric to kind of my thinking around, the psychology and the stigma and the shame issue that I confront aggressively. That, scientifically, there's that scale of morbidity being one with your disease. I make jokes that it's not the Addams family and it's not gothic and it's not following the latest Nine Inch Nails record, right?
Yeah.
I mean, the root of it being morbid, sense of morbidity means to be one with your disease, right? And in science and in healthcare, there's a scale for that. Just like there's a pain scale, and and us as patients, it's high, it's up there. So unfortunately and unfairly, we have a specific kind of relationship psychologically with hidradenitis suppurativa or acne inversa that's different than other chronic illness patients on varying degrees. Cancer patients, they go quick in most cases, right? I think I could speak for the whole HS community right now. We live a life decade after decade of dying every day.
That's
sad and it's morbid. I mean, forgive me. I really didn't want to say that, but it's the truth, right?
Yeah. That's how I felt. It even got so hard for me that I didn't want to be here anymore. I didn't have the balls to take pain medicine, overdose on pain medicine. So I would take other medicines, a whole bunch of, because I just didn't want to live anymore. Yeah. And my mom used to be like, "Well, there's cancer patients who they're gonna die soon." And I said, "Well, at least they get to die, and they don't have to be in pain all their life like we do."
Yeah, and I think again right now, what I just said and what you just said, I don't think there's another HS patient out there that would disagree with it, or at least being there at certain points, right? I mean, that's a lot of what the work that I like to do or that I enjoy and I live now, as I have no other choice because of my morbidity, right, is to fight hopelessness. And then again, and if it's caused by a lack of awareness and this umbrella of shame and embarrassment that it isn't real, in fact, right? It's fake and it has no substance to it. There's no truth to it for sure, right? That we need to hide from something, that we did something wrong.
And I don't think HS is as rare as it is. It's just misdiagnosed.
No, it's not rare at all.
There's a lot of people. There's a lot of people suffering, and they just need people to know that I'm not alone, because I felt alone before I knew what it was. I felt like there's no other kid who has this. Nobody's gonna love me because they can find somebody else who doesn't have what I have.
That's right, and I'll just elaborate a little bit on that too. I do a lot of research, right? I mean, the political conversation around HS being rare or not, if you look at it by, let's just say, rare disease standards, NORD and such, it's the milestone is if there's over 200,000 diagnoses a year, something to that effect. It's variable, then it's no longer rare, right? So I guess if we're being politically correct talking about HS, you talk of it as an orphan disease. It's not rare because it is extremely common. If you rely on the numbers that are out there now, and they're extremely skewed at best because of the state of hiding and embarrassment and misdiagnosis and lack of treatment or lack of seeking treatment, more importantly, right? The numbers are screwed, but the numbers that are out there do exceed those milestones. So therefore, politically correct, HS is not rare. But it is an orphan disease, meaning that it has no research, right? It has no effort
Yeah.
behind it in a lot of different ways. I was at the ER this week, and the attending ER doctor corrected me because I called it a rare disease. Just want to make sure you know that it's not a rare disease, right? Because she had to correct me because how could I know, right?
That's yeah.
And I just smiled. I just smiled. I've learned now in my old age. Just yeah, you're right. I understand, but it is an orphan disease, man. Right? Got it.
Yeah, that's why I think if HS was just known a little bit, if people spoke about it a little bit more, people might have a little bit more compassion, because when you go to the doctor and they're poking and prodding on you, and you can't take it, what
do you have for help, right? What do you do?
Yeah. Because if the doctor's not giving you anything, and then you're going home and you're depressed because you're hurting so bad, but nobody can help you.
Yeah.
What
do you do? I mean, that is the current state of mostly everybody, right? And it's been worse if you go back 50, 60 years, like some of our good friends in our groups, even, on Facebook.
Yeah.
We have some of the, the staunchest vets out there, I mean, a very, very close friend of mine is, these people have gone through over 60, 70, 80, 90 surgeries, some people on set in their 40s, some people on set when they're 8, there's stuff, there's case studies out there, there's data out there where not a lot. When you get these French cases, right, there's babies, unfortunately.
And that's when you were saying you don't want you're doing it for your kids. And I feel the same way, that when I have a kid, since I do have HS, I don't want them to go through what I went through at all. So
we got this.
Finding the cure is what they need to do.
I don't use the cure word, honestly, a lot. I don't think we're going to see it in our generation, in our lifetime, maybe the next lifetime, because there's just so much. I've chilled out a little bit on HS research. There's not really too much I can really continue to research historically. Let me put it that way, right? That doesn't mean that every day I don't get new alerts and all the new studies and everything, so I'm keeping up on it. But it's been now months. It's been probably 2 months since I switched over and started looking deep in my daily kind of rants on little sessions of procrastinating to end up in doing research around this disease that are very much in the autoimmune conversation, right? Mm-hmm. And that is a huge, massive, massive umbrella. And I'm there because of heredity and variables around this, because of my family and some connections and such. There's larger autoimmune conversation going on, for a fact. So my day, I don't see a cure, as people use that word, anywhere in the future at all. I just don't, until science and healthcare at large can address. We just sequenced the DNA strand not too long ago, right? Until we can fix it on that level, to stop the genetic mutations within hereditary lines, I don't see there being a cure. Now, I do see awareness, and I do see even a lot of the answers around treatment, successful treatment, right in front of people that have been here for a very long time. I share a lot of those resources all the time. I took a trip to Germany and I saw it myself. It's different over there. Awareness is different. You can look at the first page of Wikipedia under treatments and see things talked about that people in these Facebook groups, for example, won't even entertain for a second. Things that I've talked about and been called crazy, right? Things that things that I could go and pull up, 3,000 clinical studies on Google Scholar, for example. Around many things that are taboo for people and where there's no clarity around, which is kind of scary. So that's why I share lots of things all the time. It's usually not my opinion unless you ask for it.
Yeah, I'm on Remicade, and I was on Humira at first, because Humira just got. But I was on Humira 3 years ago, and to me, I was just hurting myself with the shot, and I wasn't getting any better. So
what did they prescribe you? Now, can I ask you, was it prescribed for rheumatoid arthritis?
No, it was for HS. They just went through the back door.
Really?
Yeah.
Oh, okay. I'm not sure if you want to talk about that publicly on a webinar. But by all means, never mind. Continue.
Well, now that I'm on Remicade, it has. Let's see. I've been on for almost a year, and the first couple months are great, but now they've had to higher the dose 4 times. I think that my body is just getting used to it, and the quick healing that I saw when I first got it is slowing down. But it did help me heal a lot.
Really? Okay. Yeah, I've heard some good things about that. I mean, that's like with most HS treatments. It's different. It's different for everybody. You know, I mean, not to sound like extremely morbid here, but Humira. I was just having a conversation this morning with one of our members who just got prescribed, right? And he was asking me about it. And I've written on AbbVie and Humira, and I will continue to do so for the sake of awareness. But it's either a gift for most people, right? Or a death sentence.
And
it can be. Let me put it that way. Maybe I don't want to go to that extreme, but there's definitely some of that going on.
That's how it was with when I had surgery on my groin. I was following somebody else and how their surgery turned out so great.
Mm-hmm.
Then there was some people who said it didn't turn out great, but there was more people who said it did turn out great.
Yeah.
So
it's gotten a lot better recently too. I mean, even 6 years ago, right? Where you were at, it's. I mean, CO2. I'm assuming you didn't have CO2 surgery back then. No. I mean, what's available now, the reoccurrence rate is places like Ford Health Systems, where we have some colleagues and friends, and like Angie, they're boasting over an 80% non-reoccurrence rate. The HS Trust out of Ohio, I believe, is very much in a mutual conversation. There's a clinic in New York. There's a couple other really pivotal clinics around the country that are doing really well with CO2. And it's spreading out. I mean, my dermatologist in my crappy little town has CO2 available now. Whether or not it's been available for HS is a different story, but it's available, right? So who knows? So there's some good stuff. So I'm not really always blowing smoke around, around hope. But I think there is very much so a reason to have hope around not even new things that are happening, but things that are becoming more so part of the conversation under HS, with HS.
One thing that's not good that I did was I went online, I looked at the HS clinic, and they have doctors who come from the HS clinic, and they, start their own office. They would travel to Atlanta one day, back in there and back. And
is that what you do currently? I'm sorry.
What'd you say?
Are you talking about your current treatment, who you see currently?
Well, I was going to see him currently, but he was a know-it-all, and he was showing me pictures of other patients who he didn't succeed in the surgery. So he said, I wouldn't do the surgery on you because look how bad this person was. Yeah. And, we were going to him for hope because he came from the HS clinic. What other hope can you get?
Is it plastic surgery?
Yeah, plastic surgery.
Yeah, I mean, that things are changing with them as well. And half of what's going on here that I've seen in my personal experience as a web designer are not even bad websites. Let's just talk about misinformation, right? Websites that don't have enough of a focus on them to maintain current content, quality of content, unfortunately. Yeah. I mean, I know the HS Trust still says stuff about it being an issue with a sweat glands, which is kind of scary for me. I think it's scary from what AbbVie would call the community thought leaders that are out there, right? So, anyways.
Have you heard anybody going to...
What's that? Go ahead.
Have you heard anybody going to the Mayo Clinic? The doctor said that
we have
might
people,
be good.
We have people in our group. Yep. We have someone in our group, I believe, who was there when they started pioneering HS treatments. Like I was saying, in our group, we have a lot of really amazing people who've been here for a long time. So the ones that are with us that stick around, like they're quiet. Our groups aren't the same as the other ones because we're not as hopeless. We have our days.
Yeah.
But everybody's just waiting. They're in the now. They're educated. They're aware. They're just waiting for the latest stuff. Waiting for some big triggers to be pulled, which are starting and have been. So there's some cool stuff going on that I'm very humble about.
I'm ready for it.
Well, we got to keep going. We're just starting, right?
I even would be able to. I would even be okay with going to schools and talking to kids about it because it's the same age. Even though maybe one kid out of the whole school might be dealing with it, there's still that one kid that can get help.
Probably more than that, my friend. All right. Resume. All right, Kelly, we're recording again. A short break there to reset the squirrels. I'm sorry, I really thought I would have more bad jokes for today, but I'm not myself.
It's okay.
So we were just talking about possibly doing a second kind of session here. Kelly, I'd like to talk more about you. Time won't allow for it today. More around a teen program and maybe some places we can come together there.
That'd be great.
Yeah, it's been something that on my mind since the beginning. It's coming regardless. I'm struggling with a lot of things, but it's definitely a main priority.
Yeah.
So you ran us through a lot of your story. We went off on all kinds of crazy tangents around around HS awareness and the philosophy, the good philosophy around making a difference and saving lives and changing some things for millions of people. For something that's not rare, for something that's a lot more common than anybody really has any idea right now because so many people hide it. In my opinion, I say so.
I think the same thing.
Yeah, thank God some people have us that are just saying what everybody else has on the tip of their tongue or won't, and I'm okay to take that dive, and I have been for a while now, so.
And sometimes it's just the doctors, they don't want to say you have it because they don't want to.
Yeah.
Just one more.
Yeah, I don't know if you recall in one of my videos I speak about that doctors hide as well.
A nurse told us that a lot of the times, the doctors just like to cut and go, but with HS patients, they can't cut and go. It's cut, you have to come back, you have to come back, you have to come back, and that's not what doctors want. They want to cut it and leave.
Yeah.
So they try to, surgery is the last thing they want to do.
Yeah. I think we got to be careful about making blanket statements, right? And that kind of I think conversation exists in time and space, looking at the history of where treatment's been, right? For example, we were just talking about traditional surgery that people have gone through versus CO2, right? Which is been being pioneered and has been being pioneered by a couple of really great clinics. So there's good ones out there. Things are a little bit different these days. I would just kind of want to revisit for a second.
Yeah.
But yeah, we're going to kind of wrap this up. Kelly, where did you, if you recall, I sure don't, where did we leave off with your personal story before we got into talking about saving the world?
Just how it was now.
Yeah, okay, yeah, that's right, your current treatment and where you're going. As far as, I'm curious as far as like how much time you put into travel and such, because it sounds like it's crazy. I know most people can't do that. Travel interstate, for example. But yeah, so do you kind of want to just pick up there real quick and kind of run us through anything else you wanted to talk about with me today?
Sure, I can do that.
Yeah, and then we'll follow up by all means. We'll do another webinar in a couple weeks and invite some other people and have a larger party.
Yeah.
Let's go right ahead.
Now that a lot better. That's why I said I'm just coming out of stage 3. I'm into stage 2.
Mm-hmm.
And I'm able to function. I have more of a voice for it now, and I'm not really scared to talk about it. So
you sound pretty badass to me. I've seen you online. I wouldn't mess with you.
I hope that's what they did.
Just picking on you. Take that as a compliment, as one activist to another.
Well, now I'm trying to make the video that I'm working on, which is going to be great.
Yeah, tell me a little bit about that, if you would, and I do want to hear about your ideas around the walk. I believe you had mentioned to me.
The video is just, I got a whole bunch of people to send me. Actually, I only got like 6 videos of people sending me 3 words about HS.
That's good.
Then I got
considering the audience, who doesn't like to talk about things? That's a start.
Yeah.
Right?
And I got a lot of people to send me pictures of themselves so that I can show, and it's not themselves crying, it's them being happy because they're making it through.
Awesome.
So that'll be on the video. I got voiceover stuff to be on the video.
Cool.
And hopefully it can get, it can go viral. Not for me to be famous, not for...
Of course not.
But just for HS.
Yeah, you're awesome, man. That's awesome. I will help, as you know, I will help you whatever I can do.
Yes. And the walk is just another idea that I know that it will get the word out there.
Mm-hmm.
I'm getting a lot of bad feedback about people with HS don't want to walk. But people who know people with HS would love to walk because people love to walk.
Well, I'll tell you what, just another word of advice. Piggyback our conversation we were having offline around that walk and getting people to participate within these events and these activities, right? It's hard. It's really, 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 really difficult. But that doesn't mean you quit. You don't give up. You don't give up ever, right? But and obviously it can be difficult. It can be difficult. I
even said, well, we'll get wheelchairs for the HS patients so people can push us in wheelchairs. Yeah. And they're like, well, the wheelchairs will make us look weak.
I think one thing I'm learning, even fundraising, creating a nonprofit, thinking about that, how to structure it as a business, because it is, any nonprofit out there is essentially a business, right? Mm-hmm. All the hard work being put into that. And I've started and closed businesses. It's what I do in the startup space, specifically as a designer, and have over the years. But on the topic of getting people to participate in doing things, I'm learning that, and this is going to sound bad, but I don't mean it that way, that you can't look to and depend on patients. I mean, us, these Facebook bubbles of communities. There's not a lot of them, right? There's 10, 20, 30, 40, 50,000 active users, HS, by my estimates, online any given time right now. And you look a year ago and it wasn't even that, right? So it's changing and it's growing fast. It will accelerate. But like fundraising, mostly everybody is hurting. Like you can't expect good results or even people to participate at all. Fundraising. So that's kind of where this nonprofit plan and process is originated in the last couple weeks, last couple months for me and our team. That we need to go after government grants. We need to go after monies and grant writing that is out there in public and political spaces to I swear to God, I will run a Super Bowl commercial. Doubt me. I'm kidding. Yeah. I'm kind of not kidding. If anybody knows me, there's a lot of other things to do with the money that would go into a Super Bowl commercial before that. But, the sky's the limit, right? And I've learned that there's other ways that I have to approach and go after the means to be able to do really big things that'll create change.
And I'm working with a lady who's held the breast cancer walks and stuff like that. So I'm not just doing it off my head. I'm getting somebody help me to put it together.
And to your point, like, why does it just have to be HS patients walking? Actually, maybe it shouldn't be, because we're the ones who have the knowledge, right? We need people without it to get out there. So
we run it. They walk it. We run the HS walk. Not run it. Yeah. Physically. But
you couldn't just say HS patients only show up, right? And it shouldn't be that way. I guess just a little bit of advice I'm trying to give you long-windedly is that, open up the conversation as wide as you can, right? And don't rely on the big bulk of your participation or even or fundraising for whatever you're doing to come from patients because,
Last time's cost enough.
Yes. It's getting there. Everybody has their own kind of moment in time where they can participate in what they want to. The next week's window on Wednesday may not be it for them, right? So make it as big as possible. And I mean, I mentioned something when we were just texting back and forth, messaging back and forth, that maybe some kind of component of a virtual walk might be neat. I know, other than HS and stuff, I've been involved in activism and advocacy within other spaces for a number of years now. Even in internet activism, and around privacy and stuff like that. The SOPA Acts, political kind of legislation that's gone through that I participated in, where you go and like I have a professional website, I have my Ron Burke site, and on one specific day, there's the Blackout the Internet campaign, right? So big websites go and they just black out their site and they say, I'm doing this today, right? So that's 50,000 unique visitors that just came through and got a message that they gave up as a business, you know. So maybe there's some kind of component to some kind of virtual kind of walk for HS. Maybe they're purpling out, you know, their websites, or they're changing their Facebook cover for the day to this, you know, like we are purple today, or because of this walking effort, virtual and on the streets, right? So just that's my advice. Keep it as broad as possible, you know. I want to become a motivational speaker for HS. You know, there's not a lot of things that you can go speak at, but that's what I want to become. I had an experience like that a couple weeks ago. That was interesting. Just be ready. I think if we could speak to doctors, we would get it all, because they seem to not understand the most. Well, the doctors are speaking to each other. Right, and they're specifically speaking with AbbVie right now in closed webinar sessions with thought leaders that we can't go to. Not salty at all about that. I'm not. But yeah, I mean, they are speaking with each other, and you know, as within the medical industry, there's only so much conversation to be had with patients on their doctorate level. Trying not to say that with sarcasm, but it's just the way things are traditionally, that patients aren't in this disease are not necessarily included with groundbreaking conversations because there's so much legalities and kind of crazy political stuff around it, right? Money. That's what I said. I was thinking it's sad that we want a cure, but it might not be a cure because, you know, doctors, just like there's not going to be a cure for cancer because that's where the money comes in at. Yeah, I don't know if I'm that cynical. I don't believe necessarily in the Illuminati or there's some big grand scheme out there, right? That we're not going to release this drug or whatever because it's. I mean, first of all, as Americans, like our government can't even work by itself. Like to think that there's some kind of overarching conspiracy theory keeping drugs away from HS patients is a little crazy, in my opinion. But doctors should be working independently outside of big pharma. If there's something like that happening, it's happening in big pharma. You know, like Humira, for example. I wouldn't even say that about Humira. Thank God we have someone in our corner. Is it going to hurt some people in the beginning? Yeah. You know, is it going to work for a lot of people? Absolutely. Is there some point where are they not going to develop a cure because it kills their stock price? Well, that's a little crazy to think about, right? Yeah. We just need some HS doctors, some people who have HS who know. I've said that often too. Wouldn't that'd be interesting? Our friend Angie, I know she's working with a New York clinic in the HS Trust on the certification program. Maybe that's the wrong way to put it, but some way of credentialing doctors that are in a conversation, a specific patient-doctor conversation that's righteous for good reason. So there's some things happening. There are some leaders out there that are pulling for us. And if you didn't know, they just opened up a new HS clinic in New Orleans. So no, can you tell us about that? I'm not too sure about it because I haven't went, but it's coming from LSU Health and it's a whole center. Okay, cool. I'll have to look into it. Let's maybe you and I can write a little citizen journalism piece on them. See what's going on. Yeah, that's good. That's good news to put out for people, for patients. Yeah, to tell their rheumatologist or the doctor. You have to be referred to go though. Yeah. Oh, okay. That's doesn't surprise me, being that the clinics that are out there that are working well and doing good things are just bursting at the seams with patients. Kelli, I love talking with you. This is awesome. We could go back and forth all day long, and let's do it again, right? I want to hear more about your story and dig into that next time. So let's make sure that we put some time aside to kind of revisit that again, because you and I went off on all kinds of crazy philosophical conversation. I'm good like that. I'm sorry. I like to talk, so that's probably why. Cool. So let's call this part 1, and we'll make a part 2 soon, okay? And with that part 2, I look forward to being updated and hearing more about how your walk goes and whatever that turns out for you, whatever that turns out to be for you. but specifically your video project too. So keep us all updated. I'll be sharing all your stuff as it comes out. Yourself as an advocate or activist, whatever it is you are, I don't know. I like your energy. I love your attitude. Thank you.
Thank you.
Yeah, thank you for fighting for everybody, including me. You know.
Thank you too.
Okay. We'll talk soon. Okay.
Okay.
All right.
Bye.
One, that they don't know what it is, they're completely ignorant and they're in the dark, right? I say this a lot, and I really mean it. That I remember
about
being
exactly
that
what it is that we have.